The following program is sponsored by the Medicine Center Pharmacies. You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacies. Now, here's your host, Paul White.
Well, we finally got to the radio program. Okay, good morning and welcome to the Health Matters of the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're glad you joined us. Before we begin, I'd like to thank our sponsor, Aultman Health System. Today, Brad and I are broadcasting from our administrative offices. Our special guest is Aultman III, MD, Gynecological Oncologist with Aultman Gynecological Oncology. Good morning and welcome to the show. Finally.
All right. We'd like to remind our listeners today our program will also be available on our podcast. You can look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and we'd love for you to subscribe to our program. Today, we're going to discuss cervical health and Cervical Cancer Awareness Month.
Okay. We finally got to the program this morning, folks. Tell us about your background and your career, Aultman.
I'm a G1 oncologist, which is a subspecialty in the field of obstetrics and gynecology. So after graduating medical school, I did my residency in obstetrics and gynecology at Johns Hopkins Hospital. I did my fellowships in GYN oncology at the University of Texas MD Anderson Cancer Center. I was subsequently on faculty at the University of Arizona and in private practice. And since my last year and a half, I've been working at Aultman Hospital and have greatly enjoyed it. Great community, great hospital, wonderful health team here.
You're coming from warmth to ice to ice.
Yes, exactly.
Okay. So, what is cervical screening? Cervical
screening is utilizing a testing which has been around for more than a century called a pap smear. The pap smear test is collecting cells and looking at them underneath a microscope. They can identify precancerous changes in the skin of the cervix well before the development of cancer, and that time frame between the earliest changes in the cells of the cervix to cancer is about 5 years. So if patients undergo screening appropriately, we have an opportunity to prevent women from getting cervix cancer. Over the last 20 years, there has been the development of a technology where we can identify what we think is the cause of cervix cancer, which is the human papillomavirus. And we can now detect evidence of human papillomavirus exposure by techniques that does not employ looking at cells. So we use two methods to actually look for these precancerous changes.
Wow. So who should be screened?
Well, we think all women really should be screened beginning before they have their first sexual exposure and up to and beyond menopause, depending on their exposure to the papillomavirus or prior history of precancerous changes.
So how often should they be screened?
Well, what we recommend is that the first screening should happen at the age of 21 or before they have their first sexual exposure. And then women between the ages of 21 and 29 should get a pap smear every 3 years if there's no abnormality. And between the ages of 30 and 65, we think that women should get screening with both pap smear technology and this HPV identification every 5 years, or a pap smear all by itself every 3 years. Screening for women after the age of menopause really can drop off and be stopped after the age of 74.
Okay. So do people still need screening if they've had the HPV vaccine?
Yeah, actually, we do increase screening on those patients to make sure that they don't have another precancerous abnormality identified. Sometimes these screening tests are not 100% accurate, so the repetition of those studies can help identify patients if they might have a falsely negative screening study before that.
Jeez.
The great thing about this is that this is a preventable cancer. And so doing these kind of routine screenings can help prevent patients from getting cancer. And so seeing your primary care provider on a regular basis is very important. And now we have a new technology that we can use to help prevent getting HPV infections, which is vaccination.
Gosh. So, is cervical cancer preventable?
We can greatly reduce the likelihood by making your body's immune system able to recognize and fight off any exposure to the human papilloma virus. There are several types of human papilloma virus. There are more than 100, and we think about 5 to 7 of them are most commonly associated with cervix cancer, and there are 2 subtypes that represent the cause for about 75 to 80% of cervix cancers. And getting vaccinated covers those most common subtypes. And if patients routinely get vaccinated, we can reduce the risk of them getting cancer. So in countries that have vaccinations commonly throughout the population, they've seen a decline in the incidence of cervix cancer by more than 60% over the last decade. Mm-hmm. It's pretty impressive as far as a cancer prevention tool.
What about, can patients have a screening while pregnant?
Yes. Patients can be screened during pregnancy if they have precancerous abnormalities. We may increase the frequency of examinations. Cervix cancers developing during pregnancy are very rare, and their management is a little tricky. So that's part of the reason why screening can and is recommended during pregnancy.
So should patients avoid screening if they are having their period?
It actually may make it harder to get a satisfactory examination.
Yeah.
Patients may not feel as comfortable during their period trying to get an examination. So if they have a scheduled appointment and they start their period, they may want to reschedule so they're coming back when they're not on their menstrual period.
Okay. All right. So, we're all a little bit think we're invincible at times, and maybe people use excuses for why they don't want to go to the doctor or they don't want to get a screening done. So does the exam cause any pain or discomfort, or does it hurt?
Usually not. There's usually minimal discomfort. There's the speculum, which is the instrument we use to open the vagina so that we can see the cervix. That can sometimes be a little bit uncomfortable to be placed. The pap smear itself is taking a brush and brushing some of the cells off of the surface of the cervix, and that usually causes minimal pain. There's now technology that's being developed where patients can actually collect the specimen themselves at home and submit that. And so that may actually increase the access to getting this testing done.
So how long does that screening take altogether?
Well, doing the collection of the test takes less than a minute. To get the results back is usually anywhere from 3 days to a week to get the results back.
Is there anything else you want to share about getting the screening done as far as, what to expect when you come to the doctor's office or anything like that?
Well, yeah, I think the important thing in this environment that we're in, where you want to be able to trust the providers that are taking care of you. So you want to be in an environment that you feel like is safe. There should be a chaperone that's always present. Doing a pelvic examination like this, you have to take your underwear off. You don't really have to take any other garbs off. So your upper clothing you leave intact. And the test really just takes a very brief amount of time. Oftentimes when we're doing a pap smear, we also do an internal examination to feel the cervix, to feel the uterus and the ovaries and fallopian tubes. So that's a second component beyond collecting of the cells. But again, it's very fast, and if done with dignity and respect, it shouldn't be that uncomfortable.
I don't know if I heard this before, but how long has this test been around?
Well, the pap smear test, looking at the cells underneath the microscope, was first described by a doctor named George Papanicolaou, and that's how the term was been used to pap smear in recognition of this Dr. Papanicolaou. And that's been around for more than 100 years. So, wow. Yeah, and at the beginning of the 20th century, cervix cancer was the leading cause of cancer death in the women in the United States. And now it's about the 12th common cause of cancer death. So it's really fallen off. And the pap smear is considered what we call the gold standard. That is every other screening tool, mammograms, chest x-rays, CAT scans as screening tools for diseases. This is the standard that everything else is done, because you can have this greater than 80% reduction in your risk of getting cancer if you get this screening done. So it's pretty amazing.
Okay, Doctor, our first break is here. It's time for our first break. You're listening with Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. Are you ready for vaccine season? Stop in or schedule your pneumonia, Tdap, or shingles vaccine online at medshoprx.com. Okay. How can patients make the experience less embarrassing or successful?
Having a support person there. So bringing a friend or a family member can help reduce your anxiety. So you have some familiarity and a support system. Asking to have just your provider and the chaperone be in the room to do the examination, so that this is not as psychologically stressful. The physical discomfort we talked about previously, and that's minimal. And really trying to get the information before of what to expect can actually allay a lot of your fears.
So, what does a negative test result mean?
It's take it as good news. We don't see any evidence of cancer, which is what the test is designed to test for, and that there are no signs of precancerous cells found in the smear as well. The test also now routinely checks for the human papilloma virus, and if there's no evidence of that detected, that's also very, very reassuring.
I think we already covered this, but how can patients make the experience less embarrassing or stressful?
I think having your doctor or provider talk with you about what to expect with the examination, so that step by step know what to anticipate, and then having an environment where you have people that you want to give you some emotional support. So we encourage people to have their partner or family member present. Does that help?
So, right. So, what does a positive test result mean?
Well, that means that you have some abnormal cells in the sample that was collected, and we oftentimes bring people back to have further testing, often done with a microscope that we look at the cervix with to help identify areas where the precancerous change may be coming from. So they usually get a series of tests done with that, and we sometimes take a small sample of the skin of the cervix and look at that underneath the microscope. Doesn't necessarily mean that you have cancer.
That was going to be my next question. If a positive test is, somewhat leading toward that, it just means further investigation, right?
Correct. Yes. And that represents the vast majority of patients. And they often have changes where we may do this assessment with or without a biopsy, and then the patient goes back to getting pap smears again. Having an abnormal test means that you will likely get pap smears done on a more frequent basis. And then patients who do have changes where we can identify them, if they have changes that are short of a cancer, we oftentimes can remove that area with a very simple outpatient procedure that is really causes minimal discomfort, or patients are under a light anesthesia for that. And that cures patients in roughly 80% of the time.
So I don't want to get out of line here, but I've heard before when someone gets diagnosed with abnormal cells, that doesn't necessarily mean they have cancer either. Is that correct?
Correct. Yeah, that's what I'm trying to say is they have abnormal cells, but they're not cancer.
Okay.
Right? If somebody has cancer, and that's really what we're trying to do, is make sure they don't have cancer. And if they have cells that are abnormal but not cancer, we can do something to get rid of those cells that will prevent them from being a cancer patient or get them back to where they have normal pap smears with no abnormality.
Okay. So have we talked about high risk HPV test yet, or does this kind of go along with this subject?
When I was talking about the HPV, which is the human papilloma virus, and that is a virus that is very common, and people oftentimes get exposed to that during their lifetime, and our immune system does a real good job of recognizing those abnormal cells and get rid of them on their own. So if you have exposure to that virus, we oftentimes can detect that in patients who get these studies done periodically, and then we can see that those abnormal changes may actually disappear just with your body doing its own routine work. Sort of like you get the cold and your body fights it off and the cold goes away. These kind of cellular changes, however, can sometimes lurk around in the cervix. And so if we see evidence of that infection, we want to follow those patients. There are two types of human papilloma virus that are associated with a greater likelihood of developing cancer, and that's HPV 16 and HPV 18. And in women who get cervix cancer, about 80% of the women who have cervix cancer have that particular HPV type. So that's what we call a high risk. So if you find a woman who has a normal pap smear, so the cells look normal, but their HPV testing shows they have an HPV 16 or 18, that woman is a higher risk of developing abnormal cells in the future, and we follow them more closely.
Okay. So these cell changes, whether abnormal or cancerous, whatnot, is it just the HPV virus that's causing this, or is there environmental issues or nutritional issues that we can look out for?
That's a really good question. And in general, the likelihood of developing cervix cancer is most strongly associated with this human papilloma virus exposure. However, there's very good evidence that women who smoke may have a harder time getting rid of these kind of infections. And in certain countries in the third world where there are nutritional, low protein, certain vitamin deficiencies, they may have a higher incidence of developing cancer that may be environmental or nutritionally related. And generally in the United States, those issues aren't as profound. So it's most important access to getting these smears done, the studies done, and then early detection to prevent the patient from getting cancer. And now the ability to get vaccinations is very important so that you can prevent yourself from getting these abnormal cells or cancer.
You know, I'm sure you covered this, but I just wanted to ask one follow-up question about getting screening and benefits and risks. There is no increased risk of having abnormal cells or getting HPV infections or causing any problems with getting a pap smear. Is that correct? Or can you expand on that? Is there any risk in getting this screening? You know, I'm applying that based on how you read about people that think that getting a mammogram is going to cause you to get breast cancer more.
No, it's not.
Okay.
Basically just collecting cells. So a pap smear is collecting cells. You can collect cells off of the tip of your nose and look at those underneath the microscope. So it's really just using a brush to collect these cells and look at those cells. So,
okay.
Yeah. So that doesn't cause precancer or cancer.
Okay. What about, so how does a person get HPV? Is it only sexual contact?
Yes. That's okay. Yes. So the idea that you're going to get it by sitting on a toilet seat, not really validated. It's sexual contact. And so getting the HPV vaccine before you have first sexual exposure can actually work to prevent you from having precancerous changes. So there's very good evidence in looking at the age groups of women who get vaccinations, and that seems to be the best protection occurs when young girls have the vaccine. So between the ages of 9 and 16 appears to provide the strongest protection. And then in the other end of the spectrum, where you have women who are older and even have HPV infections, giving them this vaccine also tends to give them some protection as well.
So can we treat HPV?
You can't treat HPV. It's, again, your body's immune system trying to identify and fight that off. But the idea of using a vaccine to help your body's immune system be able to better recognize any exposure to prevent the cells getting infected can help reduce the chance of getting precancerous changes in cancers. So there's not an active, like an antibiotic for a bacterial infection. We don't have that.
Okay, doctor, our second break is here. It is the bottom of the hour and time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy. You're listening to Health Matters with the Medicine Center Pharmacy. I am your host and pharmacist, Paul White. This morning, we are talking with Dr. Aultman.
It's okay. While he's working on that, what we can do is I can go over a couple things. So, we've been talking this morning about how important it is to get your Pap smear every year if you're a female. One of the things that you want to make sure that you can do is you want to make sure that you're able to find your primary care doctor. If you don't have a primary care doctor, stop in at the medicine center and see us, and we could try to help you, direct you to a doctor that's taking new patients. I know Aultman Hospital has a patient line where you can call and get directed to one of their family practice locations that is taking new patients. So if you don't have a primary care physician, it's very important. So please make sure that that's something that you can do. You want to make sure that you get your annual physical and your annual checkup, whether you're male or female. And so for females this morning, we're making sure Dr. Hallam wants you to make sure that you get your annual Pap smear screening and make sure that you've had your HPV vaccine, because one of the most preventable cancers out there is cervical cancer. And how often do you hear anyone in healthcare say that cancer is preventable? So, we can reduce that risk significantly by getting that HPV vaccine. So that's something you need to consider. If you have questions, you can ask us about it at the pharmacy. If you have concerns, you can talk to your doctor about it. But, don't let what you read on the internet sometimes get you down if you're having some challenges with respect to with how things are going to go there, because a lot of times when you have a situation with the news can blow things out of proportion. So get the facts from a healthcare provider. Okay. So that being said, other screenings you probably ought to consider. If you haven't had a blood pressure screening in a while, don't be afraid to overlook that. That's something that is important. It's quite frequent that we have patients come into the pharmacy and we find out that when we test their blood pressure that they didn't know it was high. And they say that blood pressure is a silent killer, so you need to be careful with that. Other screenings available, we do offer some blood screenings and lab tests at the pharmacy, if you're not aware. One of the popular ones we're promoting this month is vitamin D screening. Living in the beautiful Midwest and having wonderful weather like we have today, it often makes it very difficult to get adequate sunshine, and sunshine helps our bodies make vitamin D. So, if we're not living in a sunny state below, near the coast, we're probably not getting enough sun exposure to make enough vitamin D for our bodies. So you need to supplement it. And so this finger stick test is really simple to do a vitamin D test and see where you're at. And then we can work with you and your provider to make a recommendation to add some supplementation to bring you up to balance. So that's something that may be very helpful for you. We also have lab tests for lipid panels. We can do TSHs. We can do for thyroid. We can do blood glucose testing. So there's a number of different things there that we're able to do. So don't overlook the fact that just getting a simple screening can be helpful. And especially, if you have a high deductible plan, a lot of times you end up paying a pretty significant price when you have lab work done and things like that. So it might be a reason for you to check with us too, to see if there's an opportunity for us to help you get some lab tests at a more affordable price. So a lot of, we're able to do that for patients. And I think that one of the patients the patients we see most often in the pharmacy for these lab tests, like lipid panels and glucose and TSH and vitamin D, are patients that have those plans that are high deductible. So that's something that to keep in mind. Okay. As far as other screenings go, for men, there are things that we can do to make sure that we have optimal hormone levels. We do have saliva test kits that if you want to check your DHEA or testosterone levels, we can talk to you about that and how those work. There's also opportunities for us to do the same for women. So, you can get lab tests for blood to check your hormone levels for estrogen, testosterone, progesterone. And it looks like we got Dr. back. So we'll talk more about that later.
Okay. So how does a patient know if they've gotten rid of HPV?
By having multiple pap smears and HPV testing. And again, that's very common to have an abnormality and then see that it spontaneously goes away. That's what happens in the vast majority of patients. So if they have an abnormal test, we'll want to repeat it. And then if they have multiple normal tests after that, then they go back to being screened routinely.
Okay. What do you think, Brad? How close are we here?
Well, we've got time. So I know Doctor has a challenge after our last commercial break because he's got to go help a patient. So why don't we talk about some summaries for patients just joining us, okay? Or listeners just joining us, Doctor. Can you give an overview of kind of what we've covered this program, how important it is for females of any age to get screened, and some tips that basically in the next 3-4 minutes, what would you want every woman to know to help improve their odds to never hear the C word in their entire life?
I think that's a great question to help summarize things. Getting screening done by a provider as part of your well woman care is important. Pap smears are a test where we collect cells from the cervix. It is a very brief, fairly painless procedure that takes just a few seconds to collect, and that it can be done in an environment where the patient feels safe and supported. It's also part of general well health that is designed to help prevent women from getting breast cancer by having exams and mammograms, to reduce the risk of getting colon cancers by having that screening done. But with regard to cervix cancers, if you get pap smears done and testing for the human papilloma virus, we can identify early changes to prevent the patient from ever getting cancer. And then more importantly, we have now a vaccine that can prevent patients from getting cancer. And that vaccine can be given really at any age group, but works best when given to young adolescent girls before they ever have any kind of sexual exposure. And if it's considered part of their routine vaccination schedule, there is just a routine part, but it prevents them from having excessive number of exams and tests done. It prevents them from ever having a cancer and the association of surgery, radiation, and chemotherapy that goes along with those things. So it is a very inexpensive preventative measure that can be employed for everyone.
I know you've talked multiple times through the program about it. Can you speak to the people with vaccine hesitancy?
Yeah, and vaccine hesitancy is something of a trust issue. And in this environment where there is access to lots of different opinions, the opinions that are oftentimes readily available to people through social media don't have any scientific background, and they're giving biased opinions. And in the science community, we're grounded on collecting evidence, not having a bias in what the outcome will be, and use that information to guide our recommendations.
those recommendations can sometimes change over time as we collect more information. What we do know is that in countries where they routinely use the human papilloma vaccine, that they have seen the incidence of cervix cancer drop by more than 60%. So if you can do something that is one vaccination early in your life that can reduce your chance of being a cancer patient by 60%, it seems like a slam dunk to me. And there's very, very large amount of information from hundreds of thousands of women who have been using this vaccine that shows this benefit.
Hmm.
You know, before the program began, Doctor, you probably heard the news from WHBC that I don't know if they said 130 million fewer or only 130 million people got a flu vaccine this year.
Yeah.
And, you know, every year people die of the flu. You know, what vaccine's been around longer than the flu vaccine?
Yeah.
I guess I feel like, you know, I don't know. It just
And
seems
the
like one
news
of
break
those.
showed that there are 80 people in Stark County in the hospital with the flu right now.
Yeah.
And the flu vaccine is not adequately accessed. And what we do is to try to prevent another pandemic. World War I, where millions of people died, there were more people that died from the flu than died from flu. And that's something that is remembered by that generation of people, but it's been forgotten now. And when you forget things, it changes your behavior. The things that we think are used to avoid terrible outcomes become questions. And now we're seeing things for vaccinations that are just being abandoned. And you have young children dying from measles that should never have gotten it.
Yeah. All right, Doctor. Well, as we approach our last commercial break, do you want to leave some closing words and how listeners can contact? I mean, I'm sure you need a referral to see patients in your practice, but maybe you could just give some information about females who need care.
Yeah, all primary care providers are well versed in doing pap smears, just as they are well versed in doing breast examinations. It's an effective tool to identify patients before they ever get a cancer. So getting that routine screening done is important. Getting a vaccination for family members is important to prevent them from ever going through the routine of having excessive biopsies and studies done. And then if you have bleeding after intercourse, that may be one of the signs of cervix cancer. So if you have any abnormal bleeding, present to your primary care doctor for evaluation, because that may be a sign that something is going on that needs to be further investigated. So please, see your providers. Think about doing vaccines. HPV can be prevented with a vaccination, and that there is a lot of resources out there to try to help people, and sometimes the hardest part is picking up the phone. So.
Interesting. Okay. So how are we doing for time?
Well, we can take our last break, and then I've got a couple topics we can talk about to fill out the hour. So, Doctor, we appreciate you, and thank you for sharing your message today.
Thank you, and thank you for bearing with me during the glitch there. So,
hey, no problem.
Very, very interesting and very timely. Very good. Thank you.
Thank you for your time. Bye-bye.
Okay. Bye-bye. It is time for our final break. You're listening to Health Matters at the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. Thank you for joining us. Let's get back to the last part of the show.
All right. Well, Dr. Hallam had to go help take care of a patient, so we are going to talk about some current events going on in the Medicine Center pharmacies and try to help share with you some knowledge so that you are prepared going into this next sick season. So, it's the time of the year where there's a lot of things going around. My wife works as an elementary school secretary, and on any given day, they're seeing 30 or 40 kids that roll in and have some form of illness. They're seeing some flu, they're seeing some gastrointestinal stuff. So, don't overestimate the benefits of washing your hands, okay? And make sure that if you've got little ones at home, that you instill that practice in them. And, think about the whole coughing into the elbow type of thing rather than spraying the cough or the sneeze throughout the room. As far as preparing yourself and setting yourself up for success and your immune system for success for this season, we're coming into a point where the flu is starting to rage here in Stark County. As you heard in the news, there's about 80 people hospitalized in the community right now, probably more than there should be. Vaccines are a little bit hard to find in the community. We're going to have some more at the medicine centers early next week. So keep in mind, if you need a flu vaccine, give us a call today and we'll get you scheduled so we can get you in. That's one thing that has been a challenge in the area, because sometimes flu is feast or famine. You have years where it's no big deal, and then you have years where it's really bad. And it sounds like this year it's starting to ramp up. As far as other nutritional things you can do, don't overlook taking a really good multivitamin. We have some excellent multivitamins at the pharmacy that we can help you boost your immune system. Just a simple multivitamin can help reduce your risk of getting the common cold by 26%. So, there's simple things you can do by a multivitamin. We talked about vitamin D a little bit earlier in the program. Vitamin D can help support your immune system too and help you be more resilient to things going around. So let's make sure that we can help support you in that fashion. Reach out to us at the pharmacy and we can help you. Some other things that we've had questions about this week in the pharmacy, and I've actually thought about making this a common section of our program. People ask really good questions looking for answers, and I feel like at the pharmacy, we often become one that helps people find a solution. And sometimes it's difficult to get answers from your healthcare providers just because they're busy or they're booked full. We're accessible, so don't be afraid to reach out to us at the Medicine Center. This week, common question I had was, how on earth can I save money on my prescription drugs? We have had a number of people this week who have new insurance plans, and they are what they call a high deductible plan. They might have a $5,000 or a $6,000 or a $7,000 deductible. They're on the younger side. They don't have a lot of chronic medications, but when they buy a medication on their insurance plan, it comes back at this really high copay. So what we've been able to do with a lot of patients is we've been able to help them find a generic solution. And often generic medications are a lot more cost effective because they're not paying for all those fancy TV ads you see on the TV or YouTube or whatever you're watching these days. But our generic wellness program that we have a membership program, and we will actually give you our cost on the generic medication plus a small dispensing fee to cover the bottle and the cap and our overhead and things like that. And it often can be much, much less than what you would pay for your prescription copay. So if you take a medication and you aren't happy with the price and it's available generically, or you want to know if there's a solution that might be available generically, reach out to us at the Medicine Center and we can help you find a solution that is in that drug category that may help save you a bunch of money. I had a patient last week in one of our stores in New Philadelphia, Ohio, where we saved them $60 a month on their prescription drug expense. That money adds up. You could probably take that and go on vacation after 12 months. So don't always assume that you're getting the best price, and don't always assume that the solution that you have before you is the only solution. Oftentimes there's many solutions in healthcare. I also wanted to reach out and tell you all about some other things going on in the pharmacies. Since the FDA dropped the black box warning on hormone replacement therapy for women, this happened about 3-4 weeks ago, we've had a number of questions about women from, is hormone replacement therapy safe? How can I get access to it? I've heard about it from my friends. I'm tired. I don't have any sex drive. Any number of questions. If this sounds like you, we are going to be having an online webinar on February 6th, hosted by the Medicine Center Pharmacy in New Philadelphia, to give you some frequently asked questions and answers about hormone replacement therapy for women. We'll probably also touch on some solutions for weight loss and overall sleep quality and things of that nature. So if you have questions about hormone replacement therapy, we have some great resources for you that we're going to share, and we'll try to help you get some questions answered. And then one of the last things that I've got that I want to tell you about is we've been working hard to help support prescribers and physicians in our practice and in our area, because many times, not only like you, the patient, who call us, if we have providers listening, we get doctors that call and say, I have a patient that I need to help treat with this medication, but they have a problem with tablets. They can't swallow capsules, or maybe they have allergies to lactose or cornstarch or red dye number 6 or whatever. So, one of the things our compounding pharmacy can do is we can help prepare a drug based on a prescription without some of those allergens. So if you have an allergy to talc or lactose or different food colors or dyes, we can help make you a medication without that. We have patients that have swallowing difficulty, or they have nasogastric tubes that they need special formulations of medication to be able to get it administered. We can help you with that. So one of the things we've done in the past couple months is I've worked on building a section of our website just for prescribers and doctors and nurse practitioners to help them learn more about how we can make custom solutions for patients using our compounding solutions. And so if you go to our website, it's medshoprx.com, medshoprx.com. If you go there and click on the link at the banner on the top right now, we can help you get access to the prescriber-only area. It has about 14 different specialties right now built out, from everything from gastroenterology to men's health to women's health to pain management to dermatology to pediatrics and so on. It's got all these sections, and it has the most common things that we prepare for patients in a custom fashion through our compounding pharmacy. And it gives you tips on how to prescribe them for patients. It gives you background education and research articles for how you can use that to help support your patients and expand your practice options for treating patients. So please check that out. Reach out to us. We can help you get access to that. And it's something that we're excited about because it's questions that we get every day in the pharmacy, and we want to help you be successful in your practice. So I think before we wrap up, we just want to make sure that today's theme has been a lot of healthcare prevention. Dr. Hallam wanted you to make sure that as a woman, you get your normal healthcare screenings. We talked about pap smears every year. We talked about getting an HPV vaccine as soon as possible in your life to prevent the risk of getting cervical cancer by 60%. We've talked about flu vaccines. We've talked about some preventative measures for immune system and health and wellness. Probably a number of other things we could talk about too. But, if you have questions, don't be afraid to call us at the Medicine Center. We want to be your partner in health. We want to help support you. And it's something that we can do on a daily basis to help be a resource for you. So with that, I think we can wrap up.
Okay. We'd like to thank our guest, Dr. Aultman Hallam III. If you suspect you have a medical issue, please contact your healthcare provider. Thanks to Aultman Health System and our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you again next Friday right here on News Talk 1480 WHB.